So in the previous video, we looked at CPAP, how to set it up, the different mechanisms of which CPAP helps neonates breathe better, how to avoid the complications or some of the complications that you expect. And we covered a lot in that video. So today I'm going to show you how to set up the Bubble CPAP, and this is basically one of the things that I've encountered in limited resource settings, because sometimes you find there is no ventilator or the ventilators are limited and you cannot have one to set up your CPAP with. So basically the Bubble CPAP setup is very simple. One thing you need is an oxygen source, which can be like here we are using a concentrator, an oxygen concentrator, which has also a humidifier. And basically we are going to set a flow that may be starting from about 5 liters per minute to about 10 liters per minute depending. And we have to make sure that the liter or the amount of flow rate of oxygen that we set here is going to be enough to make the bubbling here. So constant bubbling is what will tell us that we are having a good enough flow. So when we look at this, we are going to use the normal nasal prongs, the normal nasal prongs that are used for oxygen delivery. But the difference here in the Bubble CPAP setup is that one limb is going to be cut and tied off. So one limb, remember the prongs always wrap around the head when they bring in oxygen from the concentrator, but this time we're going to cut one limb, and that limb, as it comes from the nose, it's going to be connected to our bottle and it will be immersed in water. So we have the inspiratory limb that is bringing in oxygen from our concentrator. This could be as well as an oxygen cylinder, and it's bringing in this oxygen. The baby is going to breathe in, and as they breathe out, they're going to breathe out into a high pressure system. This is going to maintain the pressure within the lungs, and hence we shall achieve the CPAP effect. So we have to make sure that we bury this limb in water. So the depth of the limb in water should be about 5 centimeters to about 8 centimeters. That is the CPAP pressure. So we shall measure the length immersed starting from the surface of the water until the tip of the tube. If that is 5 centimeters, then you have achieved CPAP. See if it is bubbling, and that should be improving the oxygenation, or the work of breathing of this baby should be reducing. So again, I'll remind you, if you have not looked at the video about CPAP, please go ahead and look at it. It's going to help you understand the different aspects of CPAP, the physiology behind it. And if you're new to the channel, make sure that you have subscribed. If you have not subscribed, leave a like on this video and comment. So we began this series recently, the Neonatal series, where we are covering different high yield things that you have to know before you hit the neonatal intensive care unit. My name is Benjamin, and this is Med One Pager.